all about being positive, really. But sometimes they just need to come in and let rip for an hour.
My name's Marie Weldon. I'm the manager of Women's Health Information and Support Centre, which is more commonly known in the area as WHISC. And the centre isn't topic specific, so you could be walking in for anything and it doesn't give you a label.
I came in here and it was fantastic, you know, the women downstairs, they're just so non-judgemental, non-biased, just welcome everyone with open arms.
Liverpool has got the highest mortality rate of women in the whole country. You know, we value everybody that comes through the door. So many of our service users go on to be volunteers with us. So many of them go on to do the women's health training course.
But it's all around assertiveness, confidence building, as well as learning about women's issues, family health issues, and generally the woman is at the heart of the family.
With the course, what it helped me to do was communicate with my partner and just know the right ways of just talking.
You know, you get in the group situation and then, you know, you're thinking, oh, have I got the confidence to do this, really? You start doubting yourself. But I think it's one of the best courses I've ever done.
We have delivered workshops in some of the harder to reach community groups.
So I go into sure start centres, schools, colleges, but also I work with ethnic minority groups, Irish travellers. So there's a whole range of different groups that I work with. And of course every session that I do is then geared towards that group.
For many of the younger people that we've worked with who've been involved or on the outskirts of sort of gang culture, street crime, we've been involved in tackling healthy relationships with them groups in particular. And it was quite difficult to engage with them people initially because the unhealthiness was the norm for them. And if you don't see that there's anything wrong with the way you're living your life, why would you look for help?
Quite often with these patients, it's not actually drug treatment that they're after. They're after, as you say, like a listening ear or a place to go where they can feel that they can offload.
A listening ear is literally that. It's not counselling, it's allowing people to just talk.
From when I first started using the service, I was clutching at straws, I really was. I just thought, you know, I'll try anything. And I'm really glad that I came here because to go to the extreme, it's a life-saving, you know.
I'm absolutely thrilled they won this Impact Award. It really couldn't have gone to a better place.
You can just be totally who you are and know that it's acceptable. If you want to lie on the floor and have a tantrum, that's fine. We'll just work around you.
The work that we do for some of the women that come to us, I can't really put into words, but I could tell you what one says to me regularly. WHISC is my pill. If it wasn't for WHISC, I would be on medication. And that's a really strong sentiment to put across.